Hello everyone, I'm back with you. This time I'm going to answer your questions that I have been receiving in the last 3 months. It's unfortunate how this COVID-19 has interrupted our routine services of breast clinics and caused a lot of anxiety to a lot of women. Young women also included into this anxiety, especially the young women around the age 15 onwards who are just having their breast developing, and also they are not very familiar with certain changes that they might observe in their breast. It's not uncommon to see young women as 15 years old to complain of breast symptoms. And despite what their moms, they try to calm them down and say it's nothing serious, it still cause a lot of anxiety to them, and unless they do certain investigations, they will not relax. A lot of emails I receive from different places in the world, different places where I worked before. And as easy as it is here in the UK, because here people are familiar with the system, the NHS, they will call their GP and the GP will direct. In other places, it's rather difficult. And with COVID-19, the service is completely locked and the people do not know what to do. Now, if a young woman, as 15 years old, complains of breast symptoms, and most of the times is breast pain, or they might think it's something in the breast, most of the times is nothing. Having said that, if we advise them to do an assessment, or if they don't know how to assess their breast, to ask their mom to help them, and the best time to do this assessment in their breast is a week after their periods. If their symptoms persist and they are not happy, the next step is, even if they don't have a specialist doctor or another doctor to see them, to find a specialist radiology for the breast department and do a breast ultrasound that they will clarify if there is actually anything in their breast, or is just breast tissue that because of the hormonal changes and the menstrual cycle cause them symptoms. It's not uncommon. Sometimes we do find small lumps and they're harmless. They're not serious. Those are called fibrous lumps, fibroadenomas. But it's important to do the ultrasound of the breast and clarify if it's actually a lump in the breast, and the size of the lump in the breast and the characteristics of the lump, how, in other words, how it looks in the ultrasound. Once you get the information, if it's a small lump, especially under COVID-19, and you've been told that your lump looks like a fibroadenoma or under 2 centimeters, you don't need to rush to see, especially unless your symptoms persist. But it's important to repeat the ultrasound. If you don't have any symptoms at all, repeat the ultrasound in a year time so you check the lump size. It's important, because that's what we most concern in the lumps of young women at that age. We concern and we watch if the lump changes in its size. Anything that changes in the breast at any woman, it's a rule that we don't like. We don't keep those things that change in a woman's breast. Even having said that, men also get lumps in the breast, and the same applies for men, because if they complain of symptoms, it does apply for them. But let's carry on. That's a different talk, and let's carry on with the young women. So as I said, anything that changes in the breast, changes especially its size, and we see in the consecutive ultrasounds that the size has increased more than 0.5 centimeters, then they need to see a specialist and discuss the management. If the lump is keeping increasing, we will advise you to do a biopsy or take it out. If you decide to keep the lump, it's important at certain time to do a biopsy to confirm what the histology, what it what the diagnosis and the histological diagnosis is. The ultrasound will tell you the characteristics, that it looks like a harmless fibrous lump, but later, if you decide to keep it and to keep an eye on it, it's important later, especially after the age of 20, to do an ultrasound guided biopsy and have a name on your lump, and from there on watch it. If it's a lump under 2 centimeters, you clearly can watch it with a regular ultrasound every year if you don't have any symptoms. If you get symptoms and you know you've got a lump, what do you do? If you have the symptoms going on even close to the time you had the investigations, and you've been told that it's nothing serious, and you have not seen a specialist breast surgeon, it's good to see a specialist breast doctor and discuss your problem. They will advise you, and they will relax your anxiety and give you a plan of management and follow up. It's not a rush to have it removed. Sometimes the symptoms of pain you have, and you know you have a breast, the pain is related to other factors, and mostly hormonal. Sometimes even diet can be affected, or people who smoke, or young ladies who smoke or drink alcohol, and they have sometimes fun and parties. Those fun and parties can have a bad effect on their breast. It does mean that something is wrong. I just have to change or moderate their habits. They will improve the breast pain as well. Having said that, if a lump that is kept in the breast after the age of 20, and you have not seen any change on its size of the lump so far, and you didn't have any serious concerns, it's important at some point, as I said, to do the ultrasound guided biopsy. And from there on, you decide what you will do. If it's a benign lump that is small in its size and is not changing in the routine follow-up of an ultrasound at least once a year, you still can follow that. There is very little evidence that those lumps can change to something more serious. As I said, if it does show changing in its size, because we don't want anything changing inside the breast. Everything that changes in its shape, in size, and its looks inside the breast is taken out. So it's important to do or to organize a routine approach of investigation, a simple ultrasound of the breast. We don't talk about older women, which is a different approach. And again, you are welcome to write to me at any time you are concerned. I do answer your questions in emails only, and I do follow all your emails, and I do answer to you until you are happy with the follow-up of your problem. Keep healthy, keep safe, keep protected. It's a difficult time that we go soon over it, and we get back to our new normal with a new approach to different situations, including how we look at certain things. And I have to congratulate a couple of friends of mine that I notice they do their best to scratch the inner surfaces of the people in this difficult time. And by saying inner surfaces, I do mean they put a fantastic effort to motivate people, to get them active and get them off this depression that the COVID-19 has caused. An enormous thank you and enormous congratulations in their efforts and their attempts. And having said that, I'm proud because they're my ancestors. In other words, they are compatriots from the same home country as I come, and I do congratulate and I'm proud. I'm very proud of the new generation that comes along into Greek land. And I hope one day we all go back to our homes, to our land of light, of sciences, of philosophy, of medicine. Thank you all.